Dr. Baliga here. The case scenario or multiple choice question discussed in this podcast is derived from an outstanding chapter on patient safety in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. It's authored by Dr. Anjala V Tess MD, who is Associate Professor of Medicine at Harvard Medical School. She's a hospitalist in the Division of General Medicine and Primary Care, Department of Medicine at Beth Israel Deaconess Medical Center, Director of QI and Safety for GME at Beth Israel Deaconess Medical Center. During her second year as a hospitalist, she served as a Rapkin Fellow in Medical Education. She served as an Associate Program Director for the Internal Medicine Training Program, where she was in charge of quality and curriculum development. As a hospitalist, Dr. Tess currently teaches on medical wards and is Director of Education for the Hospitalist program. Dr. Eric J. Alper, MD, is Professor of Medicine at UMass Medical School. He completed his medical training and internal medicine at UMass Medical School. In 1996, he became the first hospitalist at UMass Medical Center and helped to create the Hospitalist program there. He was the Internal Medicine Clerkship Director from 1998 to 2007 and Patient Safety Officer for UMass Memorial Medical Center from 2003 to 2006. A 73-year-old woman with hypertension and atrial fibrillation who lives in a skilled nursing facility develops delirium. A urine analysis revealed 105 WBCs. Trimethoprim sulfa, 1 double-strength PO twice a day is prescribed by telephone. 3 days later, the patient presents to the emergency department with grossly heme-positive black stool and is found to have a hematocrit of 21. Her INR is greater than 7.5. On detailed review of the patient record, the provider realizes she is also on warfarin. He states he was not aware that the patient was anticoagulated. Which of the following most likely led to this error and adverse event? A. Failure to review her medication list. B. Failure to review her allergy list. C. Incorrect antibiotic selection. D. Treatment prescribed was not necessary. E. No error occurred. This was likely not preventable. And the answer is A. In this case, the most likely explanation is that the patient suffered a drug interaction. The patient was most likely taking warfarin at the time that the antibiotic was prescribed, and this led to an adverse reaction. Obtaining a medication list at the time of prescribing, even for a seemingly innocuous problem like a symptomatic UTI, is an important step in assuring medication safety. For patients at high risk of an interaction, monitoring them closely for side effects, or in this case, changes in her INR, is critical. This patient had an adverse event, which is when a patient suffers harm as a result of interacting with the healthcare system. This can be preventable or unpreventable and is not always due to an error. For example, a patient is ordered for and receives penicillin and develops a rash. The rash is an adverse event. If the patient was not known to be allergic to this drug, it is an unpreventable adverse event. If the patient had a known allergy and received the drug, it is a preventable adverse event. A sentinel event is an adverse event which results in serious, permanent harm or death. For example, a patient who is known to have a penicillin allergy is ordered for and receives penicillin and develops an anaphylactic reaction requiring ICU care and expires due to complications. The case discussed in this podcast is derived from Baliga's textbook of internal medicine from an outstanding chapter on patient safety authored by Dr. Anjala V Tess MD, Associate Professor of Medicine at Harvard Medical School, and she is a hospitalist in the Division of General Medicine and Primary Care, Department of Medicine at Beth Israel Deaconess Medical Center, BIDMC. She is also the Director of QI and Patient Safety for GME at Beth Israel Deaconess Medical Center in Boston. During her second year as a hospitalist, she served as a Rapkin Fellow in Medical Education. During this fellowship, Dr. Tess created a model to teach quality improvement to residents. She served as an Associate Program Director for the Internal Medicine Training Program, where she was in charge of quality and curriculum development. Dr. Tess currently teaches on the medical wards and is the Director of Education for the Hospitalist program. She has led faculty workshops in both curriculum development and patient safety education. She is currently co-director of SHM and AAIM's Quality and Safety Educators Academy. Dr. Eric J. Alper is MD FACP, SFHM, is a professor of medicine at UMass Medical School, where he also did his medical training and his internal medicine residency. In 1996, he became the first hospitalist at UMass Medical Center and helped to create the Hospitalist program there. He was the Internal Medicine Clerkship Director from 1998 to 2007 and the Patient Safety Officer for UMass Memorial Medical Center from 2003 to 2006. He is now the Vice President and the Chief Clinical Informatics Officer at UMass Memorial Healthcare. He has received multiple teaching awards and has been recognized for numerous quality and patient safety improvements.